Hey, good afternoon, everyone. Thank you for joining us. This is County Executive Pat Ryan, and I am very excited to have Congressman Antonio Delgado join us. Congressman, are you there? Can you hear us?
I am here. It is good to be with you.
I see you. All right. It's good to see you. It's been a while, at least, to see your face. So thank you for making time. And before we start, I do want to
Yes,
ask how
good to see
you
you,
and
Pat.
Lacey and the boys are doing. Are you guys hanging in the new reality? Uh,
We are.
got any updates
We
for us?
are. We we're doing the homeschool thing. It's challenging. Uh, we've had to lay the law down a few times, but the boys are doing well. And everybody's in good spirits. And how is it with you and the family? I know the little one there. That's got to be a little demanding.
It's good. It's good. Yeah, he's moving around a lot now. He's crawling, and definitely we're baby proofing things. So it's exciting. It's not boring. That is for sure. Well, I know you're extremely busy, and we only have a little over a half hour with you. But I really appreciate you making the time, and I know everybody watching does as well. And we know how much work you've been doing on our behalf on a bunch of fronts. So I'm excited to hear from you on that. Just very quickly, I'm going to do the usual data updates for everybody on Ulster County, and then we'll spend the majority of the time talking with the congressman about what's happening at the federal level and the interplay between federal, state, and local. So just where we're at now in Ulster County, we are at 1,517 positive cases. We do continue to see the positive cases increase, but the rate of increase continues to go down. We've now tested almost 9,000 residents, 8,662. You can see the trajectory there. We continue to track towards the best case forecast, so that is positive news. Our recovery numbers are going up, 646. But unfortunately, we are now at 60 fatalities, 60 county residents who have passed from COVID. And I'm sure I can speak for you, Congressman, saying we send our love to all their families and their loved ones. And we have now tested, in terms of total testing, almost just under 5%, 4.9% of the total county has been tested, and we're continuing to drive those numbers up. In terms of our hospitalization numbers, this remains very encouraging. We are still at 11 total hospitalized in the county, down from, as you can see on the graph, a much higher number at the peak back in mid-April. And we're projecting that to continue to decline. And our fatality rate has stayed pretty steady, and it's well below the threshold required by the state and the governor's guidance. So on both of the measures for hospitalizations and fatalities, although they're still higher than we would like, they're well below, at the county level, well below the thresholds to meet the metrics from Governor Cuomo's plan in those categories. In terms of active cases, so this means the number who are currently active, who are currently positive, and we do anticipate this will continue to go down. We're at about 800 active cases in Ulster County, and that number continues to decline as well. And then the final public health update, this graph that I'm going to show is a little complex, has two different components, but I draw your attention to the orange line. This is really where you can clearly see that we have reached the peak and are well on the decline in terms of the situation. This is number of new positive cases each day. It's well below 20 at a point we're over 50 per day. So this is by far the most encouraging metric. And again, I updated everyone on this last week that we had turned the corner. We are now even more certain of that and are clearly on the decline, which is very good news. We still have work to do, and we have to think about how to responsibly reopen, of course. But the conditions are met, I believe, to have that discussion now. And in terms of hospital capacity, we're still at the same numbers we were on Thursday, 11 hospital beds and 1 ICU bed. Very sufficient, more than sufficient need for surge capacity there. And then finally, before I turn over to the congressman, beyond the public health aspects, as we think about the broader discussion of reopening the county. Obviously, yesterday we heard from Governor Cuomo, again outlining 7 metrics to reopen the state by region. We are in the Mid-Hudson region, and I am part of now what is a daily, well, multiple times a day, but at least one daily official call with our control group here that's made up of the county leaders and local leaders who will ultimately decide when and how we safely reopen, all driven by the data and by the public health expertise. What I will say is that although the region, as of today, is not ready in all 7 criteria, we are definitely headed in the right direction, not just in the county, but in the region. And I will have a lot more details coming on this tomorrow and really over the coming days on what that is going to look like here in the county. But given limited time, I want to get right to hearing from Congressman Delgado. And if you're willing, Congressman, I know literally just a few minutes ago, I believe, there was some proposed legislation announced by you and other colleagues in the House. Would you mind hitting on that and just overall telling us, what's going on in terms of response and the next legislation, and how the current support has been playing out? And we appreciate everything that you've done on multiple fronts. I know our business community in particular, between the PPP support and other support. So thank you for that, and for fighting for us on all these fronts.
Well, it is good to be here. Good to be able to share with the community what we've been able to work on at the federal level, and just applaud your efforts, your constant transparency, accessibility, and clear work ethic to make sure that the community here is provided for. So really appreciate the work you're doing, and look forward to continue to partner with you through this and beyond. I'll just say a couple of things of sort of where we stand. The big focus of mine has been making sure, as a member of the Small Business Committee and of the Agriculture Committee, how do I utilize those committees to make sure that our local economy here is supported, our business community and our family farms are supported. And as we all know, we did get the PPP program through the CARES Act. We then plus that up. And I would encourage folks, there are still $100 billion or so left in the PPP fund. And the burn rate has slowed down. It was at one time, I believe, something like $2 billion an hour was being lent out. Now it's down to about $2 billion a day. So, I would encourage folks who have not yet applied, small business owners of, less than 500 employees, this includes sole proprietors, self-employed, to make sure that you apply. Nonprofits, make sure you apply for this. It's a very important loan program that forgives the loan if you retain your workforce. So on that. We also, there's the economic injury disaster loan dollar bill, or 3.5 bill as well. And I also was able to fight to make sure that our farmers are eligible for the economic injury disaster loan. They were not eligible for a long time. I had a back and forth with the SBA about this, submitted a number of letters with my colleagues, bipartisan letters. Finally, we got the change after an extensive back and forth. So now, to our farmers, please apply for the economic injury disaster loan. There are funds available to you there as well. Then there is state and local government funding. We know how dire the situation is. I talk to folks all across the districts, from county level down to the town and village level. The lack of sales tax, is a big deal. Income tax, all these property taxes that's used to meet meaningful services, afford, whether it's law enforcement, whether it's, firefighters, whether it's our teachers, the tax base has come under siege by virtue of the pandemic. And so how we get state and local funding is critical. Now, in the CARES Act, which passed more than a month ago, there was state and local funding. But here is the kicker. It only went to government units serving populations more than 500,000 people. Well, we don't have any government unit in New York 19 serving that kind of population, so we were left out. And I've been working aggressively and tirelessly with my colleagues to make sure that this go around, we will not be left out. And in fact, I just introduced the only bipartisan bill out of the House called the Direct Support or Direct Relief to Communities Act with Lee Zeldin, and bicameral bill supported by Schumer and Gillibrand. Single city or town in the country, irrespective of population. And this is a nice segue into where we are right now. As of today, the House is going to be introducing or has introduced a significant package, CARES 2 or the HEROES Act. I am still working through the document. It is lengthy and there's a lot to cover. But what I can tell you as a top line is that there's going to be at least $500 billion for state relief. And then on top of that, $375 billion for local governments. That includes our counties, that includes our villages, our hamlets, our towns. And then there's a way in which all that will be broken down. And I do believe that a big part of why we're going to be able to get all of this down to our communities is because we were able to provide that formula in my initial bill that I partnered with Lee Zeldin on. So we're really working hard to make sure that the aid gets here. We know how important it is. But right now, we're in the thick of it. There's a lot of movement going on. It looks like we're going to be going back to D.C. on Thursday. I'm obviously working from home, but I'll drive down Thursday, and there'll be a vote on Friday for this package. That's kind of an overview of sort of where we stand with things, but happy to go into more detail.
So not much going on at all. Not a lot of not a lot of complexity or moving parts there.
But just a handful.
Yeah,
just a handful.
No, and I hope you don't mind a little like behind the scenes for everybody, so you understand how critical Congressman Delgado and his staff have been. Weeks ago, myself and other county and local leaders, we reached out and said, we are concerned about the impact here on our county government, our local governments. So much of our revenue relies on sales tax, and with the economy shut, that's going to be a big problem. And ultimately, what that will mean is we won't be able to provide critical services at a time when, more than ever, people need services. So to your credit, Congressman, and your staff, I mean, you guys immediately heard that and got to work in creating not just high-level discussion and talking points, but a real, as you said, a formula to figure out how can we make this work, how can we get critical funding to smaller local governments like here in Ulster County and all the counties of your district and the majority of the country, by the way, that fall under that threshold of 500,000. So I just want to thank you, and I want to make sure everybody knows how important that is and will be. All of our programs, from taking care of seniors to veterans to public health and other social services, are relying on that. And I know you know that.
It's imperative. And, I talk to, folks all across the district, and you're seeing what's happening in other counties. You're seeing layoffs, Sullivan County and Schoharie. I mean, people are really hurting. I'm talking to folks out in Delaware County. And the revenue gap is real. And local government, at the end of the day, that's where the work gets done. That's where the services are provided and coordinated. And so, to not be there for local government, to not figure out how to support in this time of crisis, would, in my estimation, be a real blight. On us in Washington. We need to do a lot better and step up. And so we are stepping up. And I think with this bill, we're going to go a long way in making sure that some aid and relief is provided.
And there are a bunch of questions, but I also do want to say, to see you working with the entire New York delegation, Republican and Democrat, on this, again, I think that's encouraging, and I hope that spirit continues. I know that will be tested in the coming days and weeks.
And it'll certainly be tested. But I do think that we put a marker down. As I said, I was the only House member to introduce a bipartisan bill that would get relief to our communities directly. And it was not easy to create that opportunity. But thankfully, we were able to have Lee Zeldin jump on, and he saw the value and merit. And I think now that we have some momentum building here, this can remain bipartisan, because this should not be a blue state, red state, type conversation. We got folks hurting all across the country, irrespective of party affiliation, and we need to act like that at the federal level.
I agree, and thank you. If you have a few minutes, we have a bunch of questions. Are you willing to take some questions?
Yes, cool. I got a little time.
All right,
a little time here.
All right, yeah, thank you very much. So a bunch of questions about the PPP program, which again is federal loans and support to businesses. A question from Sarah: What if my business is a family-owned and run business? How can we get help? We don't have a payroll. We don't have employees except for ourselves.
Well, you can count yourselves, number one, as employees. So whatever, you can first count yourself as employees. That's number one. But number two, I'm hesitating because there's some new language that's going to be a part of this bill that I don't want to law yet. But the current lay of the land right now legally is that a family-owned business, small family-owned business, has every right to apply for this loan, and if you retain all of you on, then the loan will be forgiven. 75% of that loan must be used to maintain the employees, in this case your family who work. 25% can go towards things like rent and other expenses. So as long as you maintain that 75-25 split, and you retain your current workforce as is, and if that workforce it's family owned and you're all fall within the rubric of being employees within, self-owned, self-employed, if you will, which also counts. So you take a self-employed, one shop or sole proprietor, that individual also qualifies for the PPP program. So it is a broad access point for a host of different types of businesses, including yours, Sarah. So I would encourage you to apply. There's still at least $100 billion left in the pot. We are working in this bill that we are just about to introduce and vote on this week in doing away with the 75-25 split so that you can allocate that loan however you want. That's not the case now. And that's what I was about to share with you, but that's not the case now. But hopefully we can get there once this bill becomes law. We also have set aside funds for micro businesses under 10 employees. Again, that's in the next bill. Now, this bill that we have, the CARES Act, that bill does allow employees or employers of 10 or less to apply, but they're competing against everybody else. This next bill would actually carve out a pot of money just for that type of business. So a few things that we're working on to help facilitate the true mom and pops across the country. But the short answer is, Sarah, you should apply.
That's great. And we also stand ready between our economic development team and our small business development center, which is funded federally thanks to the Small Business Committee, which you're part of, and the Congress. So working together across the levels, we're able to help Sarah and others who might have questions. You can reach out to us at the county as well. And I know your office, Congressman, is available and taking lots of constituent questions as well. On a separate topic, Carl was asking, and this really crosses multiple boundaries, local, state, and federal, but about nursing homes. Specifically, Congressman Delgado and County Executive Ryan, please consider creating a bill to mandate every senior facility and nursing home have a test for every nurse, caregiver, and visitor who enters the facility. This will mitigate seniors from contracting a virus or cold and dying prematurely. We need some policy framework to protect our elders. Do you agree? And I know this has been discussed, and there was already some funding to boost testing across the board, I believe. Yes. But would you, and I can weigh in too, but would love to get your thoughts on that.
Yeah, no, it's an important point. Actually, I forgot to flag this. In addition to the last bill, the bipartisan bill, we plussed up the PPP program $300 billion or so. We also plussed up the economic injury disaster loan program about $50 billion. And then we also added $75 billion towards hospitals, funding our hospitals, and $25 billion for testing capacity. And we also encourage the administration to devise a national plan towards testing. What are we going to do? As we open up the economy, open up society once more, we also make ourselves more vulnerable in doing so. And then contact, trace, and then contain in order to prevent another outbreak from happening. That has to be the mentality. That needs to be the plan everywhere. And nursing homes in particular, there needs to be a real concerted effort and concrete plan to make sure that, given that those are the prone hotspots, the prime hotspots, what is the plan in those areas to make sure we have aggressive testing and not even take it as a reactive measure, but to the gentleman's question, proactively be in a position where we are already thinking through what are the emerging signs or patterns and can we rein any emerging outbreak in. I do believe that there was an executive order right now from the governor that requires nursing home staff to be tested twice a week and for the results to be reported to the New York State Department of Health. And I know that in the bill that we are introducing, there are some measures in there. I don't know all the specifics off the top of my head, but I know there are some measures in there that pertain to nursing homes as well. So I think that's going to be important for folks. And I'll keep you up to date on that as we move forward on this.
Thank you. And yeah, and Carl, from our perspective here, which we've talked about before, we saw this pattern emerging early and took proactive action. We have been testing every one of our senior facilities, every resident, every staff member. We just received yesterday 3,000 additional tests from New York State, and thank you to Governor Cuomo and his team for helping us there. That gives us the supplies we need to continue that testing of all those facilities. So we're making progress on that. We're doing everything we can to be as proactive as possible. But as Congressman Delgado pointed out, that costs money ultimately. And right now that's coming from state and local dollars, which really just reinforces some of the points we talked about earlier, that if we know we need to test and trace and isolate our way out of this, and unfortunately we know that requires significant resources, and so we're all working together to make sure we have those resources. Actually, someone was asking about something that I fear got maybe a little bit, not lost, but definitely maybe a little buried in the midst of COVID, understandably, is the census. And I wanted to, someone asked about this, and I also plan to bring this up proactively as well, so thank you for asking. But folks were asking how are we doing in Ulster County on our response to the census, which is happening now. And right now in Ulster County, our response rate is under 50%. It's 48.7%. Statewide, it's 50.8%. So we're not only below where I'd like to see us, but we're below even the state average in Ulster County. And that's something that we need to step up and are working on here, but it really requires everybody's individual support and engagement on that. It only takes a few minutes. Congressman, do you want to talk about that and also how important that census count is towards us getting the resources across many programs that we need?
It's so critical. I mean, you need to understand that the way funds are allocated in many respects, particularly, at the federal level, is through, population count. I mean, perfect example. We are just now introducing a bill, state, local funding, significant amount of money. And the money that's going towards the counties and the money that's going towards the municipalities is divvied up or divided by population. So when the federal government is, distributing money to help in a scenario like this one, for example, being able to count everybody that makes up the county or makes up a city is of utmost importance, because you want to make sure that the money actually can meet the need. The money has to be able to meet the need, and the need shows up in the numbers. And so making sure that you are actively engaged in this is of critical importance. That is how we do our jobs right at the federal level, to make sure that that money hits the mark. The deadline is October 31st. And I want to make sure I get the website right here. The my2020census.gov, my2020census.gov. You can also call 844-330-2020, and folks can complete the census through the mail, over the phone, or for the first time ever this year, like I said, on the .gov website. So please utilize it, because so much of the funding and how it gets allocated is in many respects broken down or filtered through, population. And if you don't have the numbers accurately represented, you're not going to get really what you need on the ground. We're not going to get what we need on the ground.
Yeah, I want to second that for sure. And actually, you answered a question that we were getting in real time as you were answering. Carrie asked, is census being done only by mail? So again, you can do it by mail. No. You can do it online.
Now it's
you can
first
do it
time
by
ever.
phone.
First time you could do it over on email now, or internet.
And in terms of people having any concerns, I know there are some groups in our community who have had questions or concerns about could there be any negative impacts to completing the census. Could you talk a little bit about that as well?
Yeah,
I've heard some of those.
It's unfortunate that we live in a time where there's been a chilling effect on people providing information, but the information, will not, be used for any sort of purposes that, are meant to, undermine communities or put people in harm's way. I know that this is a real concern, but it's a concern more so grounded in the atmosphere that has been created by the current administration, and not in fact. And the facts are none of the information you're can or would be used in that way. So don't let the atmosphere that is created color the view and ultimately discount you, or undermine the community that we all collectively reside in. So please, I encourage folks, and if there are people who have questions about that and really want to get into specifics about that, then you should call my office, my Kingston office. And now I want to make sure I got so many numbers here. I want to make sure I get the right Kingston number, but I'll figure that out.
We'll circle back.
845-443-2930, 845-443-2930, because the data cannot be shared with other government agencies or outside groups. That is the landscape, just so we're clear. But we're always here to help, and if you need more certainty, follow up.
Thank you. And we are also reinforcing that at the local level. We have ongoing discussions across the county with many different community groups, religious groups that are all helping to get out the word. Please spread the word about the importance of the census. It only happens every 10 years. And if there's any moment, again, where it's clear how important and consequential, this is the moment. I know you need to run, Congressman, but I do want to, I have a high-level question and then give you some time to wrap up. I still continue to hear, we're over 2 months into this now. Many people, our communities just responded so incredibly positively and come together. Many people ask me, what can I do to help? How can I be involved and engaged and contribute? So if you don't mind, if you have any thoughts on that, ideas for people to plug in and give back and help those around them. And then any closing thoughts before you go run and hopefully continue to do the good work and getting us the support we need across all these different areas.
Well, let me just say again, thank you, Pat, for your leadership, and please give my best to Rebecca and little Theo.
Will do.
And it's always a real pleasure to join you. I do these things every Friday where we call local heroes. We try to identify folks in our community who are doing unbelievable work, and we just have a conversation like this on Zoom, and the amount of goodwill that is out there, the spirit, the can-do spirit of our community, the selflessness it is amazing and so awe-inspiring. And I would encourage folks to go to my website, delgado.house.gov, and you can pull up any one of these conversations and hear stories from folks who were at one time clothing designers who then turned their outfit into a mask making facility to donate to hospitals across the district, or a distillery that now makes hand sanitizers, or somebody who works for the transportation service in Sullivan County who delivers PPE, or our nurses who are working in the front lines in hospitals. There's so many good stories out there. So if you just need to be uplifted and to have your spirits raised, I would encourage you to do that. I also would encourage you to go to the website to visit the resource guide. Tremendous opportunities for folks to give. And I would ask you to go there. We also, try to do everything we can to highlight the work of organizations across the district that are doing wonderful work. But if you can see some great opportunities there. And then in closing, I'll just say, these are hard times. We're in this phase right now where the numbers appear to be improving, and that is a good thing. And they're improving because we took some pretty, rigid steps. For 8 weeks now, over 8 weeks, we've self-isolated. We've kept our distance. Businesses have obviously been impacted. Schools, our kids are home. It's a lot to do, but we did it. And it's resulted in essence flattening the curve. But we have to be careful here. This is a very critical point in the timeline, because just because we've sort of turned the corner a little bit here doesn't mean that we're out of the woods. And we have got to make sure that we are still prepared in the event, as we make ourselves more vulnerable and slowly but surely open up, that we have a plan, that we're ready in the instance that this thing breaks out again. Because history has taught us that it potentially can happen. So that means making sure we have the PPE ready, the testing capacity ready, the plan of attack if it emerges again ready. And hopefully, if we can pass this bill we choose today, we can sustain our businesses for the remainder of the year, sustain our local governments for the remainder of the year, and not feel so pressed to rush into a situation that might potentially cause us more harm. We put all this work in to get to this point, and I know it's been harsh. I know it's been hard on a lot of folks. And we at the federal level got to keep doing what we got to do. But I just encourage folks to do everything you can to not let this moment of daylight, intoxicate us too much. And we want to make and not let the partisanship get in the way. Remain united, remain focused, and remain determined, to rally around each other through this. We're going to be strong coming out of this. We are, but we gotta really discipline ourselves through this process. And of course, my hearts and my thoughts and prayers go to all the folks out there who are dealt with loss through this. It's the numbers are real lives, and it's a hard thing to accept. And I just hope that we, and our leaders, really don't lose sight of that at any point. We're talking a lot of people, a lot of families. But with that, we're going to keep working. We're going to keep doing what we got to do. And I think, we're going to keep pushing through this. And I really appreciate the time and the effort that everybody's putting in. And of course, Pat, it's always good to see you.
Yeah. Thank you, Congressman. And, you put a smile on my face, which with the kind of days I know we're all having is what we all need. So you said lift spirits. You definitely lifted mine, and I know everybody watching. So I couldn't think of a better partner to know that you're working and fighting for us. And I know everybody else feels the same way. So we have a lot more work ahead, to your point. But we have a great team at every level, federal, state, and local. And we will absolutely be making those hard decisions based on, as I said earlier, the data, the public health expertise, and getting that balance right. That is literally what I am losing sleep over right now and thinking about with my team. How do we do that the right way? This is very delicate, and just know that keeping everyone healthy and safe is and will always remain our absolute top priority. But I do think we have reached a clear turning point, and we are on the downslope, at least for now. And so it is right to think about how to do that reopening slowly, responsibly, safely. So more to come on that. Thank you, Congressman. Safe drive if you are driving tomorrow. And say hi to, it's Maxwell and Coltrane, right? Great names.
You got it.
And Lacey. All right. Thank you.
All right, man.
Thanks, everybody. Stay safe and healthy, and we will see you on Thursday at 2 p.m.